I want to talk about cancer of the breast for a moment. And this cancer of the breast study has to do with new techniques that are being used to identify cancer of the breast. Now, this ought to set up some people getting together to start to deal with the HMOs, which are very reluctant to do this kind of thing. But there was a meeting of the Radiological Society of North America in which they talked about breast-specific gamma imaging and also PEM, which is a positron emission mammography. Positron emission mammography and breast-specific imaging, radionuclide breast-specific imaging. And this study was from George Washington University in Washington, D.C. And they picked up cancers at a much earlier stage, which if we really want to cut down on mortality, we should be looking at that. And I think so that would be a sort of women's movement kind of thing. Of course, you know, to each their own. I would certainly be in support of that, but it seems to me that women are mostly going to be affected by this, and so that they're mostly going to have to speak up for themselves. I had talked about hardening of the arteries, and here is another study that talks about reversal of hardening of the arteries in the neck when you treat to very low cholesterol levels. Now, that's sort of like what I started off talking to you about, which was the Jupiter study. And this one was done in diabetics, which are sort of the worser group. If you want to take patients who've had heart attacks, patients who've had angioplasties, patients who have high blood pressure, patients who have documented hardening of the arteries, the group that gets into trouble the most, the soonest, the quickest, the worst are diabetics, because diabetes is just like blowing on that hardening of the arteries flame. So this is the SAND study again, and what I want to point out to you is they showed reversal of hardening of the arteries in the neck, reversal by getting the cholesterol down to the kind of levels that I talk about. So back to that. Now, I had also mentioned the ACCOMPLISH study that said that ACE inhibitors, lisinopril, monopril, benzapril, with a calcium channel blocker like Norvasc in combination, benzapril and Norvasc are both generic now. Lotrel is the generic combination of the two. Then there are the angiotensin receptor blockers, which I like better than the ACE inhibitors, and those are Benicar as Azor and Diovan as Exforge. Those are probably should be used much earlier in the treatment of high blood pressure because they're more effective. One criticism of this ACCOMPLISH study was that it did not use a very high dose of the diuretic, and so in that sense the comparison may not have been entirely fair. This is one of my favorite catalogs, and this is Hammacher-Schlemmer. Hammacher is H-A-M-M-A-C-H-E-R, and Schlemmer, S-C-H-L-E-M-M-E-R. And this is a discussion of things to come. OLED, that's a new technology which has been developed by Sony. And this little tiny 11-inch TV screen costs $2,000, but the contrast ratio on it is apparently 1,000,000 to 1, whereas 10,000 used to be good and 500 to 1 was not uncommon. But this is a new technique called OLED. I think it's optical organic light-emitting diode. And apparently the picture is so clear. $2,500 for a screen that is 10 by 11 by 5. Man. What do I have? Oh, here's more. Oh, here's something. This is for people who have plantar fasciitis. This is a cast, not a cast, it's a support that you can put on your foot, and it stretches that plantar tendon and makes it feel better. This is from Hammacher-Schlemmer also. I've seen it advertised, I think, also in the GAIAM catalog, but you can go to H-A-M-M-A-C-H-E-R, and then next word is S-C-H-L-E-M-M-E-R, Hammacher-Schlemmer. This is a machine that I have recommended. You can get a less expensive version of this. This is close to $500 from Hammaker Schlemmer. I'm sure it's better than the one at Brookstone, which now sells for $300. So I have the one from Brookstone, and I use it and like it. Well, that's it, 1 minute. I hope this program has been of interest to you. Happy holidays to one and all. Don't eat too much, don't drink too much. Cook vegetables, vegetable soup and beans is how to deal with this. If you have questions about any of this, give me a call at the office at 549-3444. H. Robert Silverstein, MD, for the Preventive Medicine Center and West Hartford Cable Access TV.